us tonight to talk about the repeal and replace effort on Obamacare is the president's point man on this project. Tom Price is Secretary of Health and Human Services. He's also an orthopedic surgeon and was one of the leading Obamacare critics in the House. Secretary Price, thanks for being here.
Thanks so much, Brett. Good to be with you again.
I heard you say to one of our colleagues, we look forward to coming up with a product. After hearing President Trump at the speech about all that needs to be done, and he says will be done, how far away are you?
Oh, I think we're getting very, very close. We've got good input from all individuals across the Hill. The president last night, I thought he did just a remarkable job in laying out the challenge that we have where we are right now. That is that plans are costing too much, they're providing too little care, and that it's only getting worse, and that where we want to move is in a direction that allows individuals to purchase their own coverage and have a transition from where we are right now to something that actually works for folks, whether it's buying across state lines or the like. So there's unanimity on the principles, and now we got to get down to the specifics.
Are Republicans singing from the same sheet of music? It sounds up on Capitol Hill that they're not yet. Are you going to bless a certain product, a certain plan, or are you going to kind of hand over the keys and say, you guys figure this out?
Well, as the president said last night, that we need to make certain that coverage is affordable for folks, that across state lines, purchase for insurance coverage is important, that we have some type of lawsuit abuse reform, medical malpractice reform, that we have a transition phase that works, and flexibility for the states. Those are the kinds of things that we certainly agree on. Now, the principles of having a system that's affordable for folks, accessible for folks, that's of the highest quality, and choices, and empowering patients, those are the things that we're working toward. Now, the specifics, this, as one of the individuals mentioned, this is what the legislative process looks like. This isn't anything unusual.
Right, but you have Republicans like Raul Labrador of Idaho saying the Speaker's Better Way agenda on this is talking points, not a bill. Saying that the specifics are the crucial part.
Yeah, exactly.
So let's just break down some specifics. You're talking about expanding the health savings accounts.
Absolutely. And the reason to do that is to allow individuals to purchase the kind of coverage that they want, not that the government forces them to buy. I thought the president was very powerful on this last night, and he clearly said that no longer should the government be dictating to the American people what kind of health coverage they ought to buy. So expanding health savings accounts is one of the things that works very well for a lot of the population, especially younger individuals and people just entering the job market.
Now, pre-existing conditions. You do with catastrophic pools, right?
Laid out the issue that nobody ought to lose their health insurance coverage because they get a bad diagnosis or they have a pre-existing condition. We've believed that for the time that we've been talking about this. But the challenge is if you require individuals to purchase what the government tells them they've got to require, then they don't have the flexibility to purchase something that actually works for them and their family in a unique way, because every individual in this entire process is unique. One size doesn't fit all.
Listen to Democrats on this and what they're saying about your efforts here.
They are pushing forward with a reckless repeal of the Affordable Care Act, which would rip apart our health care system and take coverage away from millions of families.
I thought that the Republican leaders in their hearts were hoping he was going to lay out a path. He hasn't. Their party is divided on Obamacare.
You look at some recent polls, Mr. Secretary. Pew, in the approval opinion of Obamacare, approved 54%, disapproved 43%. Fox News, it has evolved also, the favorable to 50%. And you can take a look at the chart of the Real Clear Politics average. That has changed as well. I think there are people who are worried that they're going to lose what they have through Obamacare. Can you say that the coverage numbers are going to be as high as currently are being covered?
This is a really important question, because right now the coverage numbers through the Affordable Care Act, through the law that we have in place, are going down. The status quo is not acceptable, and that's what our friends on the other side of the aisle don't seem to appreciate. We've got one-third of the states, one-third of the counties in this nation that are only offering one insurance plan. 5 states have only one insurance plan. There are counties in a number of states that have no coverage available to them right now. That's through the Affordable Care Act. So the baseline that we have right here, the status quo, is not working for the American people. Premiums are going up, deductibles are going up, and access to coverage is going down. So if you compare our plan as we move forward to the actual current law that we have and the downward trend that we have in people being able to be covered, I think we will show very, very well.
You have some power now as Secretary in a regulatory way to unwind some of this on your own without Congress. Are you doing that? Is that started?
This is a really important question as well, because you remember all the portions of the bill that said the Secretary shall, the Secretary may. Hundreds of regulations that the previous administration put forward. Our goal is to look at every single one of those regulations and say, does this help patients? Does it hurt patients? Does it make it so the insurance costs more or costs less? If it costs less for individuals and if it helps patients, then we want to continue those. But if it hurts patients and it costs more, then we want to make certain that we're looking at those and either repeal them or change them in a way that will make it work for patients.
You've mentioned the coverage. You believe that it will insure more people. Will their costs go down, and how do they go down?
Well, they have to go down if you allow the individual and small group market to be reconstituted. Remember, we're not talking about the folks who get their coverage through their employer right now. That's 175 million individuals across this country, and that market is relatively stable, although being challenged because of the Affordable Care Act. We're not talking about Medicare. There are challenges there, but that's not part of this conversation. We're talking about the individual and small group market, and there are about 4 million individuals who gain coverage through the Affordable Care Act, the current law, that didn't have it before. But the problem is that we've turned the whole insurance market upside down for those individuals and small groups and made it so it's more expensive, it's providing less care, and it's only getting worse. So we believe that it's imperative to fix that problem.
When the governors came in, and you're talking about possibly block granting on Medicaid, didn't they come in and say, you know what, maybe this isn't going to work? I mean, didn't that throw a wrench into the kind of plan?
I had wonderful meetings with governors from all across this nation, both Republican and Democrat. And what I heard was that if you give our state, if you give me the opportunity, the governor, to be able to fashion their program in the way that best meets the citizens of their state, then we would gladly welcome that, because they know that the dictates that come down from Washington make it that much more difficult for them to care for them to provide coverage for their citizens.
You know the criticism that Republicans have been talking about this for a long time and have not herded the cats around one plan. And I want to play the soundbite because we've been talking about it for a long time. This is Congressman Price, December 2013.
I do know that what we need is an alternative that doesn't have Washington in charge, and that's what we embrace. A plan that puts, again, patients and families and doctors in charge and provides individuals the opportunity and the financial feasibility to purchase that coverage.
You can say tonight that that is a priority for the Republican leadership after the first of the year.
Priority for the Republican leadership, as stated to us, is to have the Republican conference in the House to coalesce and unify around a health plan.
I look younger, but
Pretty wise guy there talking, huh?
But it never happened. It didn't happen.
Well,
it wasn't one plan.
You know how this town works, Brett. I mean, things don't happen until they have to happen, and now they have to happen. The president is absolutely committed to repealing and replacing Obamacare because it's not working for the American people. That's why. The Congress understands that, and we'll work through this and make it happen.
You're confident?
Absolutely.
Mr. Secretary, we'd love to have you back.
Thank you. Look forward to it.
Thank you.